Good evening, everyone. Welcome to this meeting of the Health and Wellbeing Board. It is the 24th of January. I won't do introductions because I'm going to try and keep us to time. But welcome, and I will just go straight to the first item of the agenda, which is any declarations of interest. And do I need to do apologies? Yes. And apologies, which we have from Councillor Eyre, who has been substituted by Councillor Waller. Michael Melvin has sent apologies, and Simon Morritt has been substituted by Lucy Brown from the Teaching Hospital, and Lisa Winwood has also sent apologies, and there's no substitute, so which is a shame. Mike Pagham has also sent apologies and is substituted by John Patterson. Welcome, John. Hi. So thank you for that. And Councillor Webb has already notified me that he was going to be a few minutes late, so he'll be joining us as soon as he can. There were no declarations of interest that I saw, so I will move on to the minutes of the meeting that was held on the 22nd of November. I have been notified of one very small change to the minutes under public participation, page 4, section 162. A rather important "not" is missing from the submission from Hilary Conroy that should read: service provision for autism was not the same as it was before the pilot commenced. We will make that amendment to the minutes and I will sign them as a correct record once that amendment's been made. Has anyone got any other amendments to the previous minutes? Great. Fantastic. Okay, I'll move on to agenda item 3, which is public participation. We have 2 public participants who've registered to speak at the meeting this evening. And the first of those is Hilary Conroy, who's asked to speak on agenda item 7. Hilary, do you want me to give you 30 seconds warning? No. Okay, I'll just tell you when your 3 minutes is up. But the floor is yours. Thank you.
Thank you. Sometimes I represent groups when I speak at this meeting, but today I'm speaking only as one concerned citizen to her elected representatives and decision makers in the city. I was very pleased to see that York is making a plan to address the significant barriers our neurodivergent young people are facing in education. However, I was surprised to only now be informed of the York Neurodiversity Project, due to be launched in 2 days on Friday the 26th of January. My surprise and this scenario feel all too familiar. It strikes me that despite autism and ADHD being central to almost all of my conversations in the past year, another project has been planned quietly and without the knowledge or input of our local ND community. If anyone had brought this idea up, we would have been very enthusiastically involved, as we know exactly how much our children are suffering. Perhaps the reason it has not been introduced to us until signed off and about to begin is because the organisation spearheading this year-long project are the ADHD Foundation, a charity which some of you will be aware is led by Professor Amanda Kirby. Amanda also happens to be the sole director and CEO of Do It Solutions, which everyone in the room should recognise by now as the private limited company commissioned under the Autism and ADHD pilot to collect data from our neurodivergent adults through an online survey called the Do It Profiler. I believe the ADHD Foundation is compromised by a conflict of interest. They are led by the same person as a company making profit out of barriers erected to assessment and diagnosis of the same community they claim to represent. Not only this, but Ms. Kirby and others involved in the charity blocked, threatened and intimidated people who pointed out this blatant conflict right from the beginning of the pilot last year. The charity's social media team even spoke out against the pilot publicly, while their chair benefits from it privately. Amanda Kirby is a powerful figure in the ND business and charity community. I have been contacted by people who felt that they couldn't publicly support the York Disability Rights Campaign because, despite agreeing with it, because of the power she wields. To invite her charity to lead on a 12-month programme involving York's ND children concerns me greatly. When you discuss this agenda point, I want you to be curious about how we got here and help me to answer some questions, please. How was this project commissioned and by whom? How much did it cost? Why wasn't the ND community consulted with this time? Why weren't local providers who understand our children, our schools and our community given the opportunity to develop a York-based project? Were either of our 2 universities invited to get involved? I'm concerned that the York Neurodiversity Project will amount to an expansion of data collection regarding our local ND community by a group without any local connection or accountability. I would be shocked if the Do It Profiler tool were not part of the project's plans. Not satisfied with sensitive health information of over 3,000 adults in York and North Yorkshire, it appears this group wants our children's data too. Thank you.
Thank you, Hilary, and your points will be considered when we reach item 7 on the agenda. We also have Abigail Darton, who is joining the meeting. Hi, Abigail. Do you know how the microphone works? Yeah, you just press it to start.
Is that working?
Yeah.
Yeah.
And do you want me to give you a 30-second warning when you...
I don't think it's going to last that long.
Okay.
But you can do if you
The
want.
floor's yours. Thank
Okay.
you.
Thank you. Hello, my name's Abigail and I work at York Travellers Trust, where we support gypsies and travellers with a range of things in York, including but not limited to both education and wellbeing for young people and for adults. At the moment, with really excellent support from the CYC Education Department, I'm working closely with families and schools on both a report into gypsy and traveller experiences of education in York, and also to support specific cases where young people are struggling in school, often those who are experiencing a cycle of seclusion and fixed term exclusions. One of the things that has struck me in this work is how far challenges with behaviour get before support for mental health, neurodivergence or other SEND needs are considered. Too often this results in young people with extremely complex needs being forced to sit in silence with no interaction with others or distractions from their impulses or negative thought cycles. This replicates what we see for adults in the community, where access to support is denied or referrals aren't even considered by mainstream services due to beliefs based on racial stereotypes that people are behaving in certain ways because they're travellers and that's how they are, rather than because of a consideration of additional needs. I've noticed that there's no reference to race or ethnicity in the SEND plan, so I'm wondering what can be put in place to address the fact that neurodivergent people or those with other SEND needs who also experience institutional racism are so often overlooked, dismissed, and more likely to receive punitive responses in schools and in mainstream services. On another note, I'd also just like to raise concern about the different messages being passed on to GPs and therefore patients around the right to choose options for ADHD assessments. Patients are getting different responses at different surgeries and are being required to educate their GPs on their rights. This can be emotionally exhausting and incredibly time-consuming for anyone already struggling with ADHD symptoms, but again, disproportionately impacts the mental health of those who already face barriers to accessing services, whether that be due to institutional racism or any other form of discrimination. I would like this to be considered in this meeting going forward. Thank you.
Thank you for your contribution, Abigail, which will be... Thank you, that's great. Which will be taken into consideration when we reach that item on the agenda. Thank you. Welcome, Councillor Webb. Thank you.
Apologies for being late. I come from work, and it's windy out there, so it's hard to cycle. There you go.
Thank you for you actually weren't very late, so well done. I will move on. Thank you for both of those. I'll move on to agenda item 4, which is the report from the Chair of the Health and Wellbeing Board, which is a report from me, although drafted by Tracy, and it's aimed to be an update really on the key issues and progress that has happened since the last meeting. I would draw board members' attention in particular to the Early Talk for York Award, which I think it would be useful to draw on when we get to the SEND paper, Martin, if that's something you can pick up then. And I would also raise the issue on item 8 around dental services, which members will know have been a recurring theme at the board, both from Health Watch and from other participants. I don't know whether there's anything that can be added when you reach your paper, Sarah, on item 5 to provide us any kind of update, particularly because of the troubling news of a loss of another NHS provider at Blossom Street. And although that probably won't impact in the short term on children's dental provision, it certainly is impacting on adults and therefore will impact on emergency care for those patients. And as I've said before, I'm particularly worried about the kind of double inequality of this. If you lose your dentist, you're more likely to need an emergency appointment, and therefore those groups that don't have access are kind of doubly disadvantaged. And I also wanted to draw people's attention to just the kind of wider budget pressures and the role, I guess, of the board in terms of collaboration and facilitating collaboration, particularly between health and social care partners across the city, and that being a particular challenge and a particular need for us going forward. But you know, this has always been a setting of collaborative conversation, and I just wanted to reiterate that. There is quite a substantive update on the mental health hub and mental health partnerships. Zoe, I don't know whether, I don't want to put you on the spot because I didn't give you notice in advance, but if there is anything you wanted to say around that, you don't need to come in now, but if you wanted to add anything at any point during the meeting, that would be extremely helpful. And also at the end of that report, we picked up some of the recommendations from previous Health Watch reports, particularly just to ensure that we're properly monitoring progress that we're making against those recommendations. And the two that have been picked up are just really so that when we look at the terms and conditions at the terms of reference for the committee, that we are trying to make sure that we are picking up those recommendations and coming back to them at a timely way, not to have particular issues kind of dominate the agenda, but equally to ensure that we don't pick something up and drop it straight away without keeping an eye on how things are moving forwards. So just to update people on that. Did anyone have any other comments they wanted to make on that report? Peter.
Thank you, Chair. Just two comments. First of all, Sian, Tracy and I are meeting around that last action for Health Watch recommendations. So we're looking to establish that process to assure the board that. And then to shamelessly take the opportunity to mention vaccination and measles, which probably would have got into this report if we'd have been writing it as of today, because it's risen up the agenda a little bit. But just to make the board aware that we've seen several hundred cases in the West Midlands of measles. We still see 1 in 10 York children aged 5 who don't have an MMR vaccination. Vaccination is effective and safe and can save lives. So a shameless public health plug, to be honest, for anyone watching, listening, that it's an evergreen offer. If you've not been vaccinated, you can turn up to your GP and request it, and it will happen very quickly. So just a plug to people to get themselves vaccinated with 2 doses of MMR.
Great, thank you, Peter, and thank you to the team who I know on that health prevention protection measures are working really hard to kind of monitor those things. John, did you want to come in?
Thank you, Chair. Just a quick note really in terms of today's announcement from government about the 500 million for social care. So just to mention, let's hope that will ease some of the pressure and reduce some of the risk in terms of future cuts that might otherwise be visible in the system.
Thank you. My understanding is it is welcome. Any support is obviously going to be welcome if it takes some pressure off. My understanding is it's a 1 year, I'm going to say carrot. And I think my understanding is for York, it's probably going to equate to about £1 million, which when we're making £14.3 million worth of cuts is extremely welcome, but is nevertheless a small proportion of the cuts that we are having to make, and that those cuts are being driven in a significant part by demand in adult social care, as I'm sure you know. So yes, it's very welcome, but it is actually a small proportion, and most disappointingly, it's a one-off. And I think that's the thing that is incredibly disappointing, because we know that these problems are sustained, you know, they're deeply embedded. We need sustainable investment in adult social care so that we can build capacity in the system, and a one-off, you know, one piece of funding is just not going to do that at that level. But nevertheless, we'll take anything that will help at all at the moment, given the environment in which we're operating. But thank you for that, and thank you for drawing it to people's attention. Did anyone else want to? Sarah?
Thank you very much, Chair. It might be helpful actually to comment on the dental piece now, just so I don't get distracted with my item. Also, it's a just from a technicality perspective, it's with my ICB hat on, I suppose, that I would be doing that, because the responsibilities for dental commissioning sit with the ICB and not with York Place. But I'm happy to provide some comments just now. So the Blossom Street that you just mentioned, then that was notified last week, and just to sort of confirm that there hasn't been formal notification to the ICB as that around that. So we are reaching out to the provider. As of now, we have not heard back, but we'll be doing everything that we can to see if we can work with the provider to secure services. So just on that point. And I can confirm that we were successful in the recent procurement of services following the handback of the dental contract with Bupa. So we were out to procurement in the last few months, and we have just had confirmation that that has been successful. So that's really, really great news in terms of being able to provide that NHS dental capacity to the community.
Sorry, but the provider won't be on stream till the summer, will they? Sorry.
So I'm just confirming that the procurement that's been running, obviously there's a formal legal procurement process to follow in line with regulation. So it's just to confirm that that has been successful, because quite often they are not successful. So that's really, really good news for the city to confirm that. And then the third aspect, just picking up on the point in terms of general updates, the ICB is due to hold a roundtable with all the kind of political community across Humber and North Yorkshire in mid-March. That's just been announced, so there will be further details out around that, but that will further continue the conversation around what is it that we can do to prioritise and deliver increased capacity around urgent care pathways, people with additional needs. Again, that double issue around inequalities, because often people with additional needs have to travel further away because actually they can't necessarily access the high street dentist as well. So there's a double issue there, as well as the impact on people living in areas of deprivation. So there will be that roundtable in mid-March, but I also wonder whether or not it might be worth having a future session here. I think we've talked about that before at the Health and Wellbeing Board in March. So that timing might work quite well. Chair. Thank you.
Great, thank you. Can I just clarify, and then I'll bring you in, Sian. Just in terms of the reaching out to the Blossom Street provider, what does that involve? Does that involve you kind of trying to work out whether there's a way of resupplying that same contract? And then similarly, so you can come back on both of them, on the Bupa procurement, can you just tell me what that actually means?
So I'll do my best, Chair. Again, it doesn't sit with me in terms of, I'm not a dental commissioner and I've not been involved in the procurement, but my understanding is with regards to Blossom Street, we haven't actually had any formal notification of a handback of a contract. It's been picked up through the public. So the communication has been picked up with communication with their patients. So we need to clearly understand exactly what the understanding of that situation is, what the drivers are for that, and whether or not, based on our understanding of those drivers, whether there's anything that we can do to maintain that service provision in place. So that's the next step. The second point around the procurement, essentially, there was a handback of the contract. We went back out to the market to secure an alternative provider for the provision that was provided. I think it was in Holgate, in terms of the previous Bupa provider. That has been successful. So we have secured an alternative provider that will provide dental services on the NHS.
Sian, did you want to come in? Sorry.
Yes, first, apologies for jumping in. I just wanted to clarify that the replacement for the Bupa spaces won't come on stream until the summer, because it takes a bit of time through the commissioning process for that to happen. And we have asked some questions about what that means for people who were Bupa patients and whether or not, and we haven't been able to get clarity on whether they will be prioritised. And in terms of Blossom Street, I absolutely agree. I've heard that they haven't used the commissioning process and approached the commissioner. This has all played out through letters to the public and through the press, which is probably not the best way to manage contract negotiations. But I think we're already hearing people very concerned about what will happen to them if they're a Blossom dental practice patient. And we can't give them any reassuring messages at the time because we don't have anywhere to signpost them to. So we've been flagging that up with ICS dental commissioning colleagues, that it would be really helpful to be able to offer people just a little bit of hope at the moment about where they might be able to get an NHS dentist. We've heard of people now starting to travel up to Redcar because they know there's a dentist taking people on in Redcar, which doesn't feel environmentally a particularly sound health management policy.
No, thank you. It is quite disappointing, given the amount of noise that we are trying to make about this, that the communication is happening from practice to patient, but not via any way of potentially solving the problem a different way. But that is what it is. We will continue to try our best to improve the provision of dentistry across the city, to avoid people having to travel long distances, either for routine or emergency checkups. Yeah, it is extremely disappointing that we're still in this position, but it's also very welcome that there is some movement in terms of, you know, procurement of new contracts and there being a level of service being maintained across the city. It's, you know, it feels like we're being grateful for not very much, but we are nevertheless grateful for it. So thank you. Did anyone else want to come in before I move on to the next item? Yes, Zoe.
I may as well just pick up a couple of points on the hub there,
Gave you
Chair,
enough
if that's
notice.
all right. So just a few little bits of additional information on top of what's included in the paper. We have had some successful recruitment into that initial hub as well, which is really good. The partnership that sits around the hub development has been strengthened, and they've set up some really good joint working protocols and processes that nail down a few things. We're currently looking at premises across York, to roll out that hub model, and we're working very closely with York St John as well, the university, because they also have mental health provision and a building indeed that's very close to where the hub is at the moment. So that's where we are. And we do kind of cross-fertilise and learn across both the York Place and North Yorkshire Place as well, where we're doing similar work.
Thank you, Zoe. And if there was anything from a local authority perspective that can happen in terms of space, I'm sure that colleagues will be very happy to look at what might be possible so that we can get those hubs moving. So we know that there's huge demand across the city,
Those
and therefore
conversations are taking place, and we're welcome for anybody who can offer a conversation around potential premises. Absolutely.
brilliant. Thank you for that. I'm going to move on to item 5, which is the report from the York and Health and Care Partnership. There are a number of annexes of meetings that have taken place in the interim period. But Sarah, did you want to come in and talk to the report?
Yes, thank you very much, Chair. And I'd like to invite my colleague from the York team, if I may, to just sit at the table for this item. That's Caroline Johnson, who is the Deputy Director of Nursing with the ICB, who has a focus within York.
You're very welcome, Caroline. Thank you.
Thank you, Caroline. And Caroline particularly has led on the report in here, which is called the Leader Report. And apologies for not spelling out what the Leader Report is, but it's the a report that was undertaken for people with a learning disability, and it's called Learning from Lives and Deaths, people with learning disability and autistic people. So just in case there were any questions on that, because there are some technical aspects which I knew that I would not be able to answer, Caroline very kindly has just agreed to come along for this item in case there are any questions. So without further ado, so just to kind of briefly describe again the relationship. So the York Health and Wellbeing strategy, as we sit here, the board and the strategy that we have is very much followed by the York Health and Care Partnership. The Health and Wellbeing board sets the strategy, and the Health and Care Partnership delivers that strategy in terms of the things that partners can do together, that they can only do together. In fact, there's a lot that we can all do as individual organisations, but the work that we need to do together, that's the work that sits under the York Health and Care Partnership. So just to explain the links, they are absolutely intertwined in terms of their vision. The executive committee meets monthly. You've got that set of minutes in the annex, and I'm here today just to give you an update on the work that we had been doing since the last meeting. We didn't meet in December, that was just before Christmas, and so therefore there is an update on our work in November and then some other highlights. So three main themes. We always try to theme our meetings so that we can focus on a particular area. As I said, the leader report was one of those, which we'll come to shortly. And we also had updates around two of our pieces of work around the frailty hub and the discharge stocktake. So just to give you a bit of a précis of these, the frailty hub has been running since the 1st of November, and it's my first opportunity to really give you some highlights around that service. It's doing some really great work in partnership between our voluntary sector partners, our community health sector colleagues, social care and GP. Really great model with three elements to it. Anticipatory care, so before things become a problem, crisis response, so when things become a problem, and then that enhanced discharge support from hospital. And that's been running from the 1st of November as part of our winter plans. And we heard about that at the November meeting. We were able to secure funding and get that mobilised really quickly. So that was one of our key points of discussion. In terms of the next item, the leader report. So just to give you a bit of a rundown, I'm not going to go into detail because the minutes also in Annex A give you some sense, but really important programme in terms of learning from the lives and the deaths of people with learning disability and autistic people, established in 2016, and one of the recommendations from the confidential inquiry into premature deaths. So it's very much a learning process, very clear set of statutory responsibilities and a standardised review process. And the responsibility for these reviews sits with the ICB. So we heard, we had a really extensive report based on 22-23. There were 85 reviews undertaken across Humber and North Yorkshire, and 6 of them were for people in York. The key issues, just to give you a sense, were around, the key causes of death were respiratory and cardiac. And one of the key learning elements of that review was around the annual health checks that are undertaken by GPs. So we know where those pockets are in terms of annual health checks. We are actually the second highest or second best performer in terms of York compared to the other areas of Humber and North Yorkshire. But there are GP practices that we can target to further improve on that. And Caroline's team is undertaking the work with care providers around rolling out the training and learning from those reviews. So it's not just about doing the report and understanding from an audit perspective what the learning is. It's then used with individual care providers, and that's one of the functions of our quality team, that we provide that service to our care providers. So I'm happy to take questions on that when I finish the report and bring Caroline as the expert in if there are any questions. So moving on, so that was a sort of second key item. The third key item discussed at the executive committee in November was all around our plans, working together as a system, as a group of partners, to improve the patient experience through the hospital, in terms of the acute hospital, and home as soon as possible. And it's very topical at the moment, given the pressures that we know our hospital is under, particularly after another bout of industrial action between Christmas and New Year and in the New Year period. So we came together in November to discuss the plan. There are far too many patients who are effectively stuck in hospital following their medical treatment and are deemed medically fit to leave hospital, but are unable to do so because they have a transfer of care need and needs perhaps a package of care, home care, often provided by social care, but also community response services and district nurses as well. And in terms of some of our processes are not as good as they need to be. So we should be planning to transfer people back to their home or their usual place of residence as soon as they arrive into hospital. And we know that that's one of the things that we need to do. So there's, in terms of the plan, 3 elements to this plan. Those in-hospital processes on the wards. We have a discharge hub. We need to get that working really as effectively as we possibly can. That's multi-agency, all partners working to support people to move out and home as soon as possible. Doing a lot of work around onward care needs. So are we commissioning as local authority and NHS, are we commissioning the right type of care? We've seen needs rise, acuity rise, you know, people who go into hospital generally sicker than they were 5 years ago, even last year, more multiple conditions, and that impacts in terms of the type of packages of care that we might need to support people to leave. So that's another key area. And then the other sort of key element of that is around reviewing our intermediate care capacity. This is our sort of bedded capacity in community to actually conduct assessments of care outside of that hospital setting. And often those assessments can take time to work out care needs, and can we do that outside of hospital? So I just wanted to give you a flavour of some of those plans that came through to the partnership and that we considered and signed off, and that work has it has started with real gusto from those teams. Just a few other sort of areas which we didn't pick up at the meeting but are just useful to point out. We continue to work on our broader priorities, so our joint workforce priorities, and we met in December with our education partners to identify 4 priorities around recruitment, student placements, sharing data and key worker accommodation. So again, all things that actually by working together we can do much more effectively. I won't draw too much attention to the directory of services other than to say I mentioned it last time and it's now in the report as a link because it was just in the process of being finished up. And the mental health partnership, just a point, I think this was covered in the chair's update, but just to note that this is now realigning or proposed to be realigned under the executive committee of the York Health and Care Partnership, and there will be a focus on this at the next meeting of the partnership to mark that moment. So we will get update on the mental health hub and also some of the other areas of focus and priorities. And again, Tube and City of York Council colleagues working really closely together. I caught up with them today to hear about the progress of that. So again, that might be quite well timed in terms of the proposal to pick up some of the Health Watch recommendations through the Health and Wellbeing Board next time. Final thing just to probably draw attention to is our cost of living work. Really, really key priority for us. Certainly from if I put my sort of ICB hat on again, you know, our job is not just to deliver good access to health services, it's also to be a really, really good partner to our wider determinants of health and our other partners who are delivering that work. And the cost of living packs are currently being updated to reflect that. And a number of our other areas of work are just for sort of information really, in terms of the work we're doing to target individuals with respiratory conditions with the Household Support Fund, and our proactive social prescribing work with patients with COPD. So essentially making sure that we are using the cost of living data pack to target those people who will most benefit, but also making sure that our professionals out there working in health and care are using that data in their day-to-day roles. Again, you know, data is only intelligent if it's used in a way that actually improves health. So we're doing a lot of work with our frontline professionals, and we're also launching health inequalities training program for our staff. So these were the key points I wanted to share, Chair, and happy to take any questions on any of those items.
Great, thank you. Before I open up to questions, which I will momentarily, Caroline, did you want to add anything to what Sarah has said before we have questions?
Not at this stage, it's just whether there's any questions specifically.
Great. Did anyone have any questions? Yes, councillor Runciman, and then I'll move to councillor Wall.
I think it'd probably be Lucy to answer how the review of discharges is going, which is mentioned in this report. No? I am sorry, Lucy.
I'm afraid I don't have an update I can give you, councillor Runciman, of the detail. I know it's a piece of work. I mean, we're in the throes of winter now, as Sarah's described. So it's an ongoing piece of work. We're also doing our own long length of stay reviews in the hospital as well. So, but I don't have a specific update of progress, I'm afraid, for this meeting.
I had a question about the same issue, so I'm just going to jump in before I think Sarah wanted to come back. My only question on the discharge hub was just whether or not the frailty hub, I know, is about preventing people going into hospital, and I assume the discharge hub is about getting them out quickly, and therefore I just wondered whether one of the differences was that the people who are preventing people going in are not the same as the people needed to get them out again, and that therefore just it would be useful, I think, perhaps for us to pick up outside the meeting what needs to happen to unblock both of those things. They're both really important for the health and well-being of residents, but they're different challenges, I guess, in terms of the people who need to be joined up in order to make those things happen. And I don't know, Councillor Runciman, I'm very happy to involve you in that process, given your interest.
Yeah, I think that would be very, very helpful. I think it's of concern to everybody here. Thank you.
Sarah, did you want to come back?
Just briefly, I mean, it's a really interesting observation. You know, we're so stuck in our health worlds that that's never occurred to me in terms of the fact that we've got these two hubs. I suppose there's a simple answer and a more complicated answer, but I mean, just to give you the sense that the frailty hub is not in the hospital, the discharge hub is. So the discharge hub is hospital based. It's liaising with the ward staff. The discharge liaison is nurse led within the hospital to coordinate those real complex discharges, continuing healthcare needs, that kind of thing. And then they liaise with the social workers to bring the assessments in. I think what the bit that I take from your conversation is actually why is that in the hospital, and potentially there's a way to deliver the assessment process differently. Again, that links to that. Actually, let's try and move that assessment process out of the hospital walls, and then you've got that joined up community team. So thank you for you know, for sort of highlighting that. In terms of the where we are at the moment, it's very, very challenging. If I give you a sense of the, you know, of the position, around a quarter of patients who are within, you know, acute hospital adult bed base do not need to be there. A quarter. So it has a real impact on the hospital's ability to deliver safe and effective care. As I say, the reasons for that are very nuanced. It's as much about in-hospital processes as it is about onward care. So I don't want to think that it's a community problem. It's absolutely joined up, which is why it's such a tricky thing to crack, because there's lots and lots of different elements where things could be improved. And that's what the discharge improvement plan is all about. It's tackling all of those elements. And very happy to invite elected members in to understand that a little bit better.
I think that would be useful. And Caroline, did you want to come in on that point? And then I'm going to bring in Councillor Waller, who also has a question.
Yes, I just wanted to say that there's also a piece of work that's come from the place quality group. So North Yorkshire and York have a joint quality group. And we had a brilliant presentation recently from care home sector around some of the issues around discharge. Some of that being about the referrals through so that they can then take people into the care home that are appropriate, and then sometimes they're refusing patients that they could perhaps have taken based on the information. And some of the quality aspects, when you're running very fast within providers to actually get people out, some things can slip. So actually that's not just unique to one provider, that was a number of different providers. So what we've agreed is we're going to come together as a system to look at the quality of discharges and some of the pieces of work that we can do to unlock some of that across the system. So we're very much in our early stages of that, but we're very happy to update on that as we go forward.
Great, thank you. Councillor Waller.
Thank you, Chair. I just preface my comment by welcoming more facilities at Acomb Gables. It's a great model for our part of the city, and I'm sure that there's others in other sectors, but I think it shows the value of having a facility that means that people don't have to venture all the way into the hospital, that they can get the service there in the community. And if you could look at having pain clinic there, then it would be something that I'm getting a bit of pressure from residents from. I think in terms of the discharge model, I did raise with Jamila Hussain a number of cases where people were being discharged without there being the home support. So they were left the mercy of God and good neighbours in some instances because of the way that the bureaucracy had worked. And in other cases, as you point out, people are staying in longer than they need to be because the situation isn't ready for them. And I think that there needs to be the clarity from individual residents raising cases that someone is looking at all of these different mechanisms that are getting in the way of the patient journey, and that there's a sense of progress so that people are being treated as humans and not just a commodity on the NHS conveyor belt, which sometimes they do feel like that. I know you don't intend that, but it's just that from their side, and certainly from the families, that sometimes not all of the information is coming through to the families who then pick up some of the issues from the discharge. Thank you.
Caroline, do you want to come back on that?
The points that you've made are exactly the work that we want to do through the quality of discharge work, because we do hear that on occasions, and actually there's communication is the biggest single issue, isn't it? So we are working on those aspects, and so where we've got issues, we'll use that as intelligence to be able to learn from and then inform that improvement work. I'm very happy if you want to signpost anybody to me to be able to factor that in.
Thank you. Alison, do you want to come in on that point?
Yes.
Oh, yeah.
I was just going to give an example of a project that is working, that is supporting patients out. So it is mentioned in your report, the AIDS project, which is a Age UK, North Yorkshire Sport, York CVS for social prescriber and carers. So we actively support people working with the hospital staff to discharge patients safely, set them into the home, provide rehab from North Yorkshire Sport, provide a social prescribing service, which not only gets them out, but will also help them going back in. So that's a good example of partnership working, which is, I think we're looking at 800 patients in the first year that have been discharged through that process on a shoestring, I just mentioned.
Great, thank you. And I suppose the only other thing I would add, and then I'll move on to the question from Councillor Webb, was just families are obviously part of that process, and sometimes families are part of a delay. And I don't mean that disparagingly, they absolutely need to be part of the conversation. But sometimes families think that the loved one in the hospital setting needs a particular package of care. Social care might think that they need a different package of care, and actually that interaction can often be the reason that a delay happens. And that, I guess, is just human beings, and just part and parcel of it. And I think we just need a system that recognises that those people need to be part of the process, and therefore having them involved from the get-go so that you don't slow things down is probably helpful, so that it's not a question of someone has a conversation with someone in a hospital, they then talk to their family, they then cause it's too linear as a process that therefore causes some of those delays. Is it this point? Is it on this point? Yes.
I'd say absolutely what we hear is where people don't involve carers, things go wrong. Where people assume there are carers and there aren't, things go wrong. So I think it's really important that we clarify exactly who's available to be involved in things going forward when we're planning all this stuff. So absolutely agree.
Is it on this point?
No.
No, I assume you've got a new point. Yeah, that's why I was waiting. Zoe, do you want to come in on this point?
I did, and I'm sure, as you would expect from me, I just want to mention that mental health are a partner involved in all of this as well. And I think one of the examples I would give is Pathways to Recovery from Foss Park, which is a partnership between the voluntary sector, Tees Esquire Valleys Trust and City of York Council, where we support people upon discharge to try and reduce and stop readmissions back into hospital. We also have liaison teams who work into the acute hospitals as well. And of course, we're involved in the work with the system.
Great, thank you. And look, one of the roles of this whole board is to facilitate some of those relationships and conversations so that we are all joined up in how we're recognising problems when they occur. Councillor Webb.
Thank you, Chair. And I think it's actually quite nice. My question is quite broad. So I think actually hearing from Alison and Sarah and Zoe about what the partnerships are and what's going on is quite important. Thank you for the report. I think it's really, really interesting and really, really useful. On page 19 of the pack, you talk about workforce, and you've got a section in there about priorities agreed in December and sort of what it is you want to do this year to sort of support and improve workforce. I wonder if you could maybe speak a little bit more about that, but also for me, I think it'd be really helpful to give us a sort of an overview of what the workforce situation is right now. You know, what is if you've got a plan to improve recruitment and retention, what's your targets? What are you aiming for? What are the issues you're facing right now? And Alison, from a voluntary sector point of view, I wonder if there's anything similar you could add in afterwards. Maybe not, but it's up to you.
Sarah, did you want to come back on that?
Just a small question, fair.
Go big or go home, that's the point. I think.
Yeah,
Big
I
question.
can see why you went last. That's good. I think sharing our data is deliberately on this list, you'll see, and that's because we don't know the answer to that question as a place. We understand it for our, so York Trust understands its vacancy position, where the pressures are, what the agency spend is and how that's driving up some of the financial costs. Likewise, Zoe will know that for Tube. Alison may have a reasonable sense of what that looks like for the voluntary sector, actually. So actually able to do that across a group of organisations, and primary care may have an idea of what that looks like, but we don't stitch it together. And I think that's one of the missing pieces of the puzzle. And I mean, data is one of the things that, we're constantly battling against, but this is an area that if we actually were able to plan effectively across the system, you might be able to match up some of those vacancies with some of those, some of those wider skill sets, broader skill sets that might also support us to deliver more early intervention and prevention. We get a huge amount of value out of our non-statutory partners in terms of the work that they deliver. And actually, could we join that up much more much more closely? Are there vacancies that actually are down to training issues? And actually, do we need to grow more of certain people to be able to fill some of those gaps? And actually, could we link much more effectively with our schools and our colleges, to be able to do that if we had those connections? So I think the questions is absolutely the right one, and we can't answer it at the moment, but we've got that ambition to deliver. But that's not an easy task, and I doubt we'll have that perfect by the end of the year, but we'll make a start.
Yeah, I don't think it'd ever be perfect, would it? But I think it's the reason I'm raising it is for that partnership sort of work, and I think that, like you say, that point 4 about workforce data and sharing that data is absolutely key. But thank you for that. I don't know if anybody else.
I knew that luring carrot of data was going to get Peter involved, and it did. You said it too many times. So Alison, I'll take you first and then Peter.
Yeah, data doesn't float my boat, as you know, Peter. Voluntary sector. So we have the same challenges of recruitment as we've had for the past couple of years since COVID. I think it's improving slightly, that when we advertise jobs, we're getting more applicants than we have before. So we're not having to go 2 or 3 times. So it's improving very slightly. I think our key challenge is retention. And those of you around the table have heard me say this before. It's about our very short-term contracts that we have. We've got about 7 or 8 at risk at the minute because the contract's not being renewed. We've got resignations because people have mortgages to pay. So our key issue is always going to be about very short-term contracts or not being told in timely enough time that contracts will be continued. Very articulate. So that's always going to be the challenge. And I think the complex nature of the stuff that we're dealing with in the sector and the high volume, it's high pressure. So it's, you know, why would you really work, you know, in the voluntary sector? You've got high complex cases, no job security, and very little else apart from the joy of working for a local voluntary organisation, which is what we do. So I think it's slightly better than it was, but retention is the key challenge.
Can I just come back on that one? Because I think, firstly, you know, what our voluntary sector do is absolutely fantastic and is, it, you know, like you said earlier about working on a shoestring, that's so true. And it's not right, but we are where we are, I think, at the moment. But I suppose my question would be, how closely do you feel you work with sort of other partners around the table in that planning? Because your question is about, could we talk about longer term planning, which is what Sarah was saying. Do you feel you're part of that conversation?
I am part of the workforce ICB group. My main area of work on that is about volunteering and trying to encourage more volunteers and look at opportunities to improve access to volunteering amongst health and care. So there's a huge piece of work happening about that I'm happy to talk about another time. The challenge we have in working with workforce with health and care is the thorny subject of salaries. Is that, you know, if we have a recruitment event, which we did, didn't we, before Christmas, we're competing against the same people. If you work in health, you're going to get this much, social care this much, voluntary sector this much. So it's really difficult to entice people to work with us. And there's different reasons to work with us, you know, from what you get from working with health, for example. So we do try to work together. We are involved in conversations, but it's very difficult, I think, to align ourselves. But we are part of discussions, and we can now access lots of training and lots of resources, like the ICB, like about health and wellbeing. So things are improving, but it's always going to be difficult. It's the same issue as health, working with social care around staff, isn't it? Because of the packages that people get. I don't know how we get around that one, to be honest.
Peter's going to tell us.
Well, it was actually a question not on either on data or on the workforce, if I may, Chair. Apologies. I recognise all the issues that Alison's mentioning there. It was going to be a question for Caroline on the leader report. I think one role of this board is to celebrate some good stuff that is happening. So just to say that when I joined the CCG, as it was, the majority of people with a learning disability in York were not getting an annual health check. And actually the increase in the number who do now, we've still got a way to go, is a testament to primary care for a start, because that's where most of them are carried out, and really, really good, strong work to increase that rate. You mentioned to the leading causes of death that people with a learning disability would be cardiovascular disease and respiratory disease. Both of them are in some ways preventable or have preventable elements, and checking people's health is very helpful, but I guess it's not it doesn't lead necessarily to improvement in health. So do you pick anything up through that process that would help us as a system to learn lessons about how can we improve the physical health of people, support improving the physical health of people living with a learning disability?
I think what you've picked up on is exactly where I'm at in my thinking at the minute. So as you know, I've only joined the ICB quite recently. And one of the big questions I keep asking is the so what? We know all of this. What are we actually doing to address some of those issues? And I think there's more we can do. So what we have got is we've got now an ICB-wide group for our leader programme. So it's not just set in place, it's actually joining across, which actually brings you more resource, it brings you more thinking, it enables you to look at more of the themes and trends as well on that bigger footprint. But there will be some issues that are very much specific to place. So some of the challenge that I'm putting into the mix is what are the quality improvement projects that we can feasibly do? So at this stage, I'm unpicking that at the minute, and I'd really welcome a conversation actually, because I think there is a lot more we can do. I mean, you look at some of the issues that are in there in terms of the learning. Some of those issues are the same issues for people without learning disability as well, but they will be compounded by different variables, won't they? And I, hand on heart, can't say that I think we're going far enough in some of those issues yet. That is the ambition, that actually we truly get proper quality improvement, and we test things out at small scale and then look at whether they work. So I'd really be interested in that conversation, because I'm asking the same questions.
Great, thank you. I'm going to move on because there's half a chance of sticking to time. I just had one final comment, Sarah, if you wouldn't mind taking it away. Annex B has this brilliant directory of services to support people to stay well during the winter months. I guess I just wondered what happens the rest of the year, and whether or not there was a way of just having a version of it for the rest of the year that wasn't the winter. I know that it's a special thing in health world, the winter, but we also hear from you all the time that, you know, winter pressures are now year-round pressures. So I guess we just need to know what we should be doing the rest of the time. But thank you, is only a little thing. Right, I'll move on to agenda item 6, which is the theme for the meeting, which is a bit late to be starting our theme. Welcome to the meeting. Neil, you're very welcome. Yes, please join us. I don't know whether Maxine, you want to come up now, or whether you just want to just join us when we come to the next item? I'm happy either way as well. I just thought, given your then you can always chip in. Then if you want to chip in on this item as well, you're very welcome to. So this is agenda item 6, which is the Children and Young People's Plan. Martin, is Neil talking to the plan first?
Yeah, I think just very quickly to introduce the Children and Young People's Plan, and to give some background. Children and Young People's Plans were introduced in some regulation in 2005, when we had the local safeguarding children's boards and children's trusts. There's actually no requirement of a local authority to have a Children and Young People's Plan anymore, but I think we feel it's really important. It's the ambition for the city across partnerships. It doesn't involve everybody in terms of developing the plan. It does involve many of the partnerships, and it certainly involves young people fundamentally in terms of its development. It sets out the ambition for everybody that works with young people right across the city, whether that's an education establishment, an earlier setting, to a GP or anybody else. So this is trying to set an ambition across the city about what we'd like, what we want to do, and how we want to work with children. But from there, I'll pass over to Neil, and hopefully I've not stolen any of your thunder.
It's only about 90% of what I was going to say, so that's fine. Yeah, colleagues will be familiar with the concept of a Children and Young People's Plan. What we've looked at in the development of this one is what are the components of what makes a good childhood? What do you need to have in place for children and young people to thrive? And that's reflected within the plan, and having those components in place makes sure that children have a sense of belonging as well within the city that they live. We know that York is generally a great place to live for many children and young people, and you will look at a lot of headline outcomes, and you should be rightly encouraged by those. But I think many of us know that York's story is one of inequality, that if you're at risk of worse outcomes, actually York can be a harder place to live. So what we've done through the plan is to carefully review the data that exists, the Joint Strategic Needs Assessment and other sources of data that are available. What are the messages that children and young people tell us about their experience of living and growing up in York, and engaging partners in developing the plan. The plan is included in Annex A of the papers. I should mention to you that there is now a designed up version of the plan. I'm afraid you didn't get the beautified version, but we're happy to share that with board colleagues. The content is broadly the same. So the plan itself sets out our strategic ambition for the city, and it puts that under sort of 4 broad headings. So we want to make sure that all children and young people have the best start in life, that they're happy and healthy, that they stay safe and they're ready for the future. The Children and Young People's Plan is not a spectator sport. It is something that we would expect anyone working with children and young people in the city should be able to articulate what it is they do that makes a contribution towards those priorities. There are a number of more detailed specific areas under those that we are looking to see improvements in. Annex B sets out how we will know we will make a difference. This is a combination of a data scorecard, and the indicators are listed within Annex B. It also includes continuing to hear messages from children and people about their experience and what is different about living in York, and then also seeking assurance from partners about the activity they are doing and what impact that is actually having in taking forward the priorities set out in the plan. We would be producing an annual report alongside the business planning process for the Safeguarding Partnership to be able to summarise the progress or otherwise against the plan. What I'd also draw your attention to is within the plan, at the end, it has a number of provocations, really questions about actually, if you're in agreement that these are our shared priorities for the city, which I would hope that you would, what are you actually going to be doing to be making those real within your own individual agencies, within your roles, within the city, within the system? This is a shared plan, and if we don't do it together, it doesn't happen. It is a partnership plan. It's been on a tour of a number of different partnership forums and sessions, this obviously being a key one. As a council, the council would look to move to sign off our commitment to it next month through the council's executive, but we're asking the other key agencies involved as well to take it through their own relevant sign-off processes to make sure that they're endorsed and signed up to delivering against the plan. So I'll stop talking at that point because I could talk for longer, but it might be better to take questions or comments on the plan.
Great, thank you, Neil. Martin, did you want to add anything else? Great. I had one question. I'll just kick things off. I am under the measuring section, which I now can't find, page 73 of the full report annex. Those measurements that you are using, I recognise because they're things that the council carries and I see a lot. I just wondered, and some of this is hypothetical, but what's missing that we don't control in the local authority that you would actually like to know? What could others around the room, for example, add to that list for children and young people in the city that might help us to deliver this plan better than we are already managing to do as a local authority? So that was my question, but I'll leave you to think about it. You won't have to answer it straight away because I realise it was quite a challenging one. And I'll come to Councillor Runciman.
Thank you, Neil. Interesting as ever. Two questions, and you may have said some of this. I'm not catching everything that you're saying from that enormous distance tonight, or the loop isn't catching it. I'd like to know, first of all, how it's going to be distributed, and secondly, whether there'll be an easy read version so that young people know what we're trying to do for them as well as the professionals.
At the risk of doing this very politically, would you like me to take a few questions and then you can come back on them all together? All right. Alison.
Yeah, so you've clearly done a lot of co-production with children and young people. And I'm just looking for reassurance really that you've also included co-production with the voluntary community sector, because I know we've got one, because I know you work with us, but there's not much mentioned in this about us. And I think picking upon what you've just said, if the sector was involved, we could probably come up with some of our own outcomes as well. So I'm sure you have, Neil, but I just wanted to double check because it's not mentioned much apart from one line, which I think is probably a bit of an oversight because there's lots of really good work being done.
I'll take some more and then Sian.
I actually just wanted to come in on that point about, I wondered as well if any of the data that was gathered through the Together for Young People project that sat under the Multiple Complex Needs Network, whether any of the information they gathered from their sessions with young people had fed into this. So I think they were picking up some stuff. I haven't been directly involved in that project, but it sounded like there was some quite interesting learning going on. So I didn't know whether that had fed in. And also, I'm assuming you've read our reports on children's mental health, particularly to feed into this.
There are others indicating to come in, but actually I realise I'm now overloading you, Neil. So why don't you come back on the things that have been raised so far, and then people can have another go.
Yeah, that's helpful. If I miss anything, then please remind me. So in terms the question in terms of the how will we know and the data, and is there any data we would like that we haven't got, is an excellent question. And I wish I wish I knew that you were going to ask that question, because I would have come more armed. Because some of the data does reflect the data that is available and is the best proxy measure really for the outcomes that we're wanting to achieve. If it's okay with yourself, Chair, I'd like to sort of take that as an open offer, that as we continue to work our way through the plan, that we can develop better measures that more closely align to the outcomes we're wanting to see. In terms of how it will be distributed, once we've formally launch the plan, there will be a launch, not an event, but there will be certainly publicity and will be shared throughout the strategic partnerships and networks of the city in terms of promoting and sharing that directly with young people. Then yes, of course, we will share that with young people, and that's part of our commitment to them to say, actually, this is what we're committing as a city to delivering for you. So please be assured on that. In terms of co-production with the voluntary and community sector, I mentioned a task and finish group that came together to develop it, that we had representation of key partners from voluntary community sector within that task and finish group. So apologies that hasn't read through in terms of the actual report itself. That's helpful feedback. In terms of together with young people, in terms of the feedback that's they have gathered, it wasn't specifically reflected within the actual development of the plan, but having looked at their reports, there's real synergies between what the young people are identifying through that project and what we've been putting forward as priorities. So I think that gives us real confidence that these are the right priorities, and we should be looking now at the what happens next and how do we actually start to address those. And yes, it's not included within this, but I'd be happy to share it with you, Sian. There is I think the technical term is a Padlet, which describes the suite of different data sources that were used to arrive at these priorities, which includes various reports from Healthwatch as well. Yep, I'll share the Padlet with you.
Great. I've had Sarah indicate, and then I'll come to Peter.
I wonder if you're going to say the same thing. I suppose so. Probably three things that I was going to pick up, but so just in terms of an ICB, just to say, really fully endorse the Children and Young People's Plan, and happy to take it through whatever forums you would want us to take it through in terms of exposure. We also have a Children and Young People's Board actually on Monday, so that's quite well timed. Martin, I think you're on the agenda actually. So
Sarah, could you just speak more directly into your microphone?
Yes,
I'm
sorry,
just
I
mindful,
realised
and
I was
actually it's a
Neil.
message to everyone around the room that if anyone is using a hearing loop in here, they cannot hear if you don't speak into the microphone.
Yeah, apologies. So it was just to say that the ICB would fully support this in terms of our strategic vision. Start well, live well, age well. Well, we would do a lot worse than investing in our children and young people in terms of in 10 years' time, many of them will be our future workforce. And our future adults. And, in terms of some of the rising risks that we have in health, it makes very, very good sense to be really investing in our children and young people. And we should be talking about our children and young people in everything that we do. So I just wanted to provide that endorsement and reiterate something I said at our Place Partnership committee last week. Neil was there, Martin, I don't think you were, but just to reiterate, we have 6 priorities as a place, and one of them is working together for children and families, and we need to stitch this together better. would be, but that was my comment last week. And Neil, I think you took that back really strongly, to ensure that we are giving greater visibility to the work that is being led by the local authority, and again, being a very, very good partner in health around access to care and quality of care. So I just wanted to make that statement as well. And just a final point around data, and this is partly to my NHS Trust colleagues as well, is that we must ensure that we are able to collect data and make it available at place level for children and young people, because the data that's reported through trusts is meaningless from a improvement perspective and from a local planning perspective. It's fine for assurance, but not for improvement. So just to pick up on that point in data, if there's anything that we need to do to support, and Zoe and Lucy, if you could take that back through NHS Trust, that would be helpful. Thank you.
Okay, there's now a long list of people wanting to come in. I'm just going to tell you the order in which I've got them. I've got Peter, Councillor Waller, Alison, Councillor Webb and Martin in that order currently. If you can indicate if you want to come in, if people want to come in on specific things that people are saying, if they can indicate while they're saying, did you want to come in on that particular point? In which case, do you want to come in now, and then I'll move on to Peter.
It's just providing some additionality, I think, in terms of Neil's response. So, first and foremost, this will fundamentally sit under the safeguarding partnership. So we have a safeguarding executive, which represents the three statutory partners: police, health, and social care, the local authority. The partnership are bound to work with every organisation, including the voluntary sector. So once a year, we have a partnership event in which we learn a great deal about what our ambitions in terms of what actions we want to put in place to make sure that children are safeguarded and their well-being is certainly considered. As well as that event, we have something called Section 11 audit, which is done every 2 years across all parts of the system to ensure that children are well looked after, safeguarded, supported through every organisation, including the voluntary sector. So that's another area that we'll start to consider. This will be part of a main document that sits under all of those different elements of the partnership work. And my only request would be, we have been working on this for a long time, and we haven't got it off the ground in terms of making sure that it's finished. And I think whilst this is one of the parts of the journey that we need to have in terms of making sure that we take some feedback, could I ask of partners, including the voluntary sector, if we could have within 3 or 4 weeks, at the very most, some data back that you think that you could collect that could contribute towards this, as well as some very specific comments in terms of if you think there's something that you can add value to, then this is just part of the process of getting it to a final document.
Great, thank you, Peter.
Thanks. Well, I've commented a little bit already to Neil on this, just to say really welcome it and thank you for the work you've done on it. The happy and healthy section, I'm really glad is in there, and I think there is something in that data collection that we possibly can do to reflect, I guess, that much more upstream bit of public health. In the health and wellbeing strategy, we use the phrase health generating city, and I think there is maybe something about some of the indicators that are there at the moment, which are valid, but are quite sort of healthcare based. And thinking about, data availability, it's worryingly hard to get national data on children and healthy lifestyles, essentially, since the national surveys were pulled in the middle of last decade. But with the school survey, I think there probably is something we can do. I mean, just some things I'd chuck in is how are we doing on children's access to green and blue space? How much time are children spending outdoors and with physical activity? It's such an important bit of learning and growing. And I think there are things within the school survey which could help with that. The problem is we do it relatively infrequently, but possibly that is just the challenge to partners on that bit. It is not just to make our data collection tend towards the health bit, which is helpful, but it's that health generating bit, which I think we want to see as part of this.
Great, thank you, Peter. Councillor Waller.
Thank you, Chair. Just to pick up on a number of points. In terms of the so what, children and young people are very effective at telling you. what they think, and in terms of looking at data sets, I think that would be helpful to have that check and balance in there. On a more in-depth issue, CAMS regularly comes up in terms of conversations with pastoral teams, and we've had discussions at this board before. I know Maxine's been very closely involved with discussions, and in terms of the reports that Health Watch did, I pushed a lot of schools to say, don't tell me, tell Health Watch to capture all of that. So I think what I'd like to see is a sense of what's happened in the intervening time. Zoe would very much like your input into this, in terms of these processes have been implemented, this work is happening in schools. Yes, there are always things that you would like to do long term, but I think the sense of this partnership is delivering, and I'd like to see that sort of captured in this, so that there's a sense of we are working together more effectively to ensure that children are getting that good start in life.
Thank you, Councillor Waller. Alison, did you want to come next?
Just a very quick point. We have a new human rights indicator report, which will be coming out within the next month. So I'll get that to you, because you might have some more up-to-date stuff in there that you want to refer to. And I was going to make a comment about, I can't see reduction in poverty, and I found it under the future. And I just think it probably should be a bit more running through everything rather than just in the future. Anyway, perhaps just a bit more reference to poverty and a reduction in children living in poverty all through the plan. It seemed to be right at it was the very last thing. So it's like, is that really being taken seriously? I'm sure it is.
Thank you, Alison. Councillor Webb.
Thank you, Chair. And yeah, Alison, I think firstly, straight away, are we taking poverty seriously 100%? And I actually think that just thanks to Neil, I think this is an ambitious piece of work that's been put together. But I actually think this has been a really, really valuable conversation to actually get partners from different parts of the system. And the thing I was going to say at the first part about this is, one, there's a deliberate focus on sort of vulnerable children in an unequal system, as Neil sort of opened with. And I think that's really important that we don't lose sight of that. But also the call to partners to be involved and engaged, and Sarah in particular, thank you for your comments about support and a plea to bring data together. I think that's really, really powerful. And yeah, as Martin said, anything that we can do over the next few weeks to sort of bring things together, I think will be really, really important. And the final one, I think Councillor Waller said it really well. So thank you for raising the question on mental health. I think that is something that when you speak to young people, this is something that comes up time and time again. And I think that what is in there is good, but I think it's always important that we keep raising this. So I think that was a really important point. So no specific questions. I mean, I have to say, as exec member for children, I've seen this document a few times, and so it's actually been quite nice to listen to what other people have got to say from different perspectives. So yeah, thanks for the work that's happened so far. And with anything like this is what we want to do, but then that's a living document then, isn't it? It's actually, okay, so how do we bring it into life? And what we've done here tonight, actually, I think sort of warmed it up a bit. So that's really important. Thank you.
Great, thank you, Councillor Webb. And I think that was exactly what struck me when we were having the conversation earlier, is that kind of demonstrates the kind of evolving nature of this plan, is that this is a partnership challenge. This is not something that sits in one place. It's something that is owned by the city, and it's down to everybody in the city to play their part in delivering it. I'm just going to say again what I said to you at the Health and Care Partnership meeting last week, which is my only concern, and I've said this to Martin as well, is just around schools and ensuring that they're properly looped into this and bought into it as part of that partnership. We aren't going to be able to deliver it well without them, and we need them. And we know that they're all in it for children and young people as much as anybody else would be around this table. So they are very welcome partners in this process, I'm sure. But I think Martin now just wants to come in on that.
Yeah, and I think it's a really helpful comment. Children spend a great deal of time at school children spend a great deal of time at school, and it's a fundamental part of their sort of upbringing. So we do want to work closely with schools. We obviously don't manage schools, but we are trying to set an ambition that helps them reflect for themselves about whether they're meeting some of the ambition of the city and all of the other partners that are signed up to it. The one thing that we are currently looking at, and I'm going to have a conversation with the Safeguarding Executive, is in December of last year, there was a new Working Together 2023 published, which is an update from 2018. There's been an ambition nationally to think about how we include schools, which are each and every one of them is an independent entity. It's not managed as a system in the same way as all of our organisations are, but how do we bring them together to think about safeguarding as part of a system? We thought there may be some legislation that would perhaps bring schools as a fourth statutory partner to the safeguarding partnership. It didn't. It showed some ambition to do that, and there may be some legislative change in the next couple of years. I think to get ahead of that, for York, I'd like to invite a representative of York Schools and Academies Board, which represents all of the schools in the city, to sit as an executive member on the exec partnership, but that will be up to the other two partners to ensure that they are in agreement. And then underneath the safeguarding partnership, we have a whole load of subgroups that look at anything from learning of things that go wrong within the system, to look at lots of other different subject areas. Within a subgroup, we're hoping to develop one which just focuses on education and its contribution towards safeguarding and wellbeing, which will bring all of the safeguarding leads across the schools in the city, particularly the secondary schools, to work with us under that guise of a safeguarding executive. So we are doing some work to try and make sure that we bring schools into more into a wider system.
Thank you, Martin. And the meeting is asked to endorse and include its views. It has definitely included its views. So thank you for that. And I just wanted to kind of double down on that kind of appeal, I guess. Everyone around the table has got the interests of children and young people across the city. There's no conflict there. Everyone wants those things to be better for children and young people across the city. And I think that's why that's important, that this is a partnership, and that this is, when budgets are tight and things are difficult, it's easy to kind of lose sight of some of that. Everyone is here for the right reasons. People in education are in there for the right reasons. And even though things are difficult, I think it's important that this plan is about that shared vision for children and young people across the city. And so therefore, thank you for bringing it to us. Thank you for all the work that I'm sure you and many others have put into bringing it together and doing all the consultation and the processes that have had to lead to the document in the form that we've seen it. So thank you for that. We're very happy to endorse the report, and hopefully it will continue to be a living document that we can all help to contribute to with data or with information or with support and guidance or whatever it is that is needed. But thank you for all your work on it, and we're happy to endorse it. I will move on to agenda item 7, which is the SEND update. I would just like to remind the board that this was the item on which we had public participation earlier. And I would just ask Maxine Squire, welcome again. And if you'd like to speak to the report, is Maxine speaking first, Martin? Yep. And then I'll open it up. Thank you.
Okay, thank you. And thank you to our contributors as well. It's very, very helpful.
Oh, Maxine, can you just move your microphone?
Sorry.
You could
It's,
just
it's
move the
very
mic.
helpful to have public participation on this agenda item. One of the reasons why I'm really very, very pleased to be here this evening is I want the Health and Wellbeing Board to fully understand and embrace the work around special educational needs and disabilities in the city, because this is a true partnership piece of work. We are subject to an inspection regime which looks at the way in which the local area partnership works around children with special educational needs and disabilities and their families. So just as we said, with the work around the Children and Young People's Plan, this piece of work is very much dependent on really high quality partnership working. And that's at the heart of this update as well. We were initially inspected as a local SEND area back in 2019. And there were some areas of weakness that were found in 2019 by Ofsted and the CQC, which we worked on through a written statement of action between 2019 and November 2022. That led to an inspection revisit, which gave us a health check that we were moving in the right direction. Not that everything was fully solved in those areas, but that we were making significant improvements in the local area in terms of the way that we were working together as a partnership. One of the things that we developed during our work on that written statement of action was really embedding the work between the local authority and health as key partners working around SEND. It's one of the things that I've been delighted to see that the ICB have also recognised needs to be taken forward. And I know now that there is a strategic drive around SEND within the ICB. That's very welcome, as I say, but it's got to be something that we now work together on with our remaining areas for improvement to ensure that we don't lose any momentum on our improvement journey. A key part of that improvement journey is, as a partnership, beginning to work together to look at what our local area inclusion plan will be, which will it will be the refresh of the local area SEND strategy. And we need to do quite a significant piece of engagement work around that in the next 12 months. It's really important that the voices of the local area are fully included within that. So I do welcome the contributions that we've had this evening about ensuring that participation and voice is driving any of the decisions in the local area. So really very, very timely inputs from colleagues in the neurodiverse community in the city, and also from the Travellers Trust. In education services, we do work very closely with the Travellers Education Trust, and they've been a key partner in some of the work that we've been doing to look at those barriers to engagement with education that young people from the community have, because what we're wanting to do is again ensuring those strong partnerships that we're developing help to remove those barriers to education for all children and young people. SEND obviously is something that can affect you regardless of your race or ethnicity. It is about identifying the needs that you have that create barriers in your everyday life, but also celebrating the strengths that you have as well. And one of the things that we've been very keen to do through the work that we've been doing on SEND is ensure that we are celebrating the strengths of young people with special educational needs and disabilities, and hearing their voices and using that to also understand more about their lived experience in the city. What works well currently? What are the things that we need to work on to ensure that they are living their best lives and feeling fully included in the city? And so
quite a lot of the work that we do currently is around voice groups, working with children and young people in schools, but also as well developing the strategic voice of parents and carers through the partnership we have with the Parent Carer Forum. And that came through very strongly in our inspectionary visits, where it was felt that we'd made significant strides across health and the local authority in terms of co-production. And we were thrilled that inspectors recognised the work that we were doing on co-production, and the inspection report did highlight that as an area of strength that was being developed in the local area. Do we always get it right? No. And, you know, sort of we're always open to developing more and more links with partners in the city and listening to the lived experience and the voices. That's hugely important in the work that we do around SEND. In our work on education, health and care plans, we want to ensure they're more meaningful for young people themselves. They are very technical documents, and they're very often written from the point of view of professionals. One of the pieces of work that we are currently doing is ensuring that children and young people with education, health and care plans feel that they are meaningful, that they're accessible, and that they reflect their ambitions and that the support that they need to be able to achieve those ambitions in the future. It was interesting because Councillor Webb and I listened to a group of young people earlier in the week who were part of our Access for All group, which is our SEND voice group. And there were a variety of responses about how meaningful EHCPs were to them. They did say that they trusted their parents to represent them through their EHCPs, but they also talked about the fact that it was important that the plan helped them to achieve in school. And they were very articulate about the things that do work and the things that don't. But what we came away with is that we also felt that certainly in the case of those young people, they could see the contribution that their school was making towards meeting their needs. And it's very important that we also highlight and celebrate the good work that goes in the city, in our schools around special educational needs and disabilities, as well as the challenges that schools and young people face in meeting those needs. I think the key thing for you as a Health and Wellbeing Board is that SEND is everybody's business. It's a really important part of the way that a local area works together to develop the partnership around young people with special educational needs and disabilities. Those needs don't end when they reach 25. And it's important that we see this as part of a whole life journey. And the work that goes on 0 to 25 is as strengths-based as possible to ensure that we're actually supporting that transition into adulthood in a way that means that those children and young people who will become a really important part of the city's community feel that they're making the strongest contribution that they possibly can to the life of the city, because we've consciously thought about what their life journey is going to be. Some of the areas that are coming out of the new area SEND inspection, I've summarised at paragraph 14. They're really important for us to consider as an area SEND partnership. Our response in terms of, have we got the strongest possible approach to health commissioning in the local area, which thinks about those needs of children and young people with special educational needs and disabilities, particularly around things like waiting well. We know there are some challenges around access to therapies and waiting lists in the local area. One of the things that we have to make real is, what does waiting well mean?
what is the experience if you are on a waiting list for a speech and language therapist or occupational therapist, or you're waiting for access to mental health support through CAMS. It's those types of things that I think we really do need to be aware of and work on. We need to get better at information sharing and communication. So I do welcome, as I say, the challenge that we've had this evening from two important partners in the city. We have to get better at that. And although we've made some important strides, we've got to keep going, and we've got to keep ensuring that everybody's voices are heard as we are taking our decisions about commissioning in the local area. We've just engaged with a really important piece of work. Thanks to our colleagues in public health, we are refreshing our SEND JSNA, our Joint Strategic Assessment of Need. That's happening between now and March, the scoping for that piece of work. It's really crucially important because it will also inform the refresh of our SEND joint commissioning approaches. So these are really important things that we're working on with colleagues in the ICB around this. But it's also how we get voice into those commissioning decisions. And you know, sort of that's making that easy is really important, because we need those connections, and we need people to be proactive in terms of contacting and putting those ideas in place. The work continues, obviously, on ensuring that we've got a joined up approach to SEND in the local area. So one of the things that is really welcome is strategic oversight of what we're doing, be that through the Place Board or through the Health and Wellbeing Board. So I was really pleased that the Health and Wellbeing Board had actually asked for an update on SEND, because I do think it's a really important thing for everybody to be cited on. I'm going to stop prattling because I'm sure that Martin will want to say more, but I hope that gives you an overview. I also wanted to highlight one piece of work that has been co-produced and launched in the autumn, which is the Ordinarily Available Provision Guidance, which was co-produced with our Parent Carer Forum, with our schools, and also we're looking for feedback now from our young people about are they starting to see some of that making a difference. But it's been a really important piece of work and has been really embraced by the SEND partnership.
Just before I bring you in, Martin, just the challenge to the room, I guess, is the thing about SEND is that people think about it as an educational thing. And actually the thing that is interesting about bringing an SEND update to the Health and Wellbeing Board is that actually having special educational needs actually has a huge impact on how you access health services. So certainly I have picked up from residents, it affects whether children can brush their teeth.
Yeah.
It affects how they brush their teeth. It affects how they feel when they go and sit in a GP waiting room. It affects how they feel if they end up in the hospital or in the A&E department. It affects, you know, it affects how they can access
Dentistry.
yeah, food. It affects what they eat. It affects how they access exercise or how they feel about physical activity. So therefore, the kind of challenge, I guess, to the room is we're having an update, and that I guess for the context of this room is why it's really important, because the role of everyone here is to ensure that we are thinking about those things when we are, you know, going about everything else, which, you know, in the context of everybody's very, very busy and challenging daily lives is just another thing to be thinking about. But that's why I think
it's a really important point, actually, Chair, that one of the common criticisms in the SEND, the early iterations of the SEND inspection was that in most local areas, they felt it was too education-led. And that wasn't a criticism of education. It was actually that education was having to drive the partnership. And obviously that's also a reason why I also wanted to ensure that the Health and Wellbeing Board were cited on the fact that this is truly a partnership piece of work.
Absolutely. And that's why, you know, we've had plenty of conversations around this board about that kind of thing. And also because it tends to focus on children, I think that's the other reason. But obviously special educational needs don't stop just because you stop going to school. So therefore, anyway, I'll bring Martin in now, and then if anyone else wants to come in, just let me know.
Thank you, Chair, and I think those are really helpful comments. This is a system, it's not the local authority or just the education system. What I would like to do is just celebrate a couple of things, which includes the fact that we've listened to parents, families, and other professionals within the system, recognising that within the education healthcare plan, that sometimes we have a limited impact around the social care aspect of that, and we have invested as an authority into the role of a designated social care officer at a time where funds are very limited, and obviously we've got some considerable challenges. The greatest challenge is actually recruiting to that post, but we'll get there, I'm sure. I think the other issue I wanted to just raise, which Maxine has touched on, is the waiting well issue. You know, a young person that is waiting for an assessment, family that's waiting for assessment, we just need to make sure that we've absolutely done everything we can as a group of agencies working together to ensure that a young person's able to still access other areas of their life that are important whilst they're waiting. You know, a young person that's not able to access education, for example, or going to school as a result of waiting for something can create some considerable damage long term. I think from a speech and language communication perspective, really want to again acknowledge some fantastic work that's been done in the city that has been grown as an innovation from the city, which is Early Talk for York, and that will be extended to more Talk for York. It's something that I think we could perhaps look at investing in further with partners to take to recognise that speech and language is a very specialist support need. There isn't enough people in the field to be able to recruit. It is a wicked issue. It's not something that even, you know, if we threw plenty of money at it, it's not going to address the issue. It's much more complex than that. So I think in terms of speech language communication, there are young people that are currently on waiting lists that could perhaps be identified at the age of 2 and still be waiting at the age of 5 when they're entering school. That's missed some real opportunities, some considerable opportunities in terms of making sure that they're school ready. And yesterday we heard about the attainment gap that exists in York between those that are disadvantaged and those that aren't. So that's an area for me that there has to be a really central focus, a laser focus on how can we do better where young people have got an identified need, where we can perhaps do something a bit more innovative than just keep waiting and saying they'll see a specialist eventually. Those specialists aren't going to get any bigger, I suspect, over the next 5 years. In fact, if anything, they're probably likely to reduce as people leave the profession. So Early Talk for York is just a great example, a really strong example of how we can think about how we innovate together in that space. And I will shut up in a second. I think the final point is the 2 speakers. I don't want to ignore the fact that there's a point raised around the ADHD Foundation and how we've come about how we've reached a point of wanting to work with that organisation. It is a charity, it's a national organisation, it's a well-respected and recognised organisation across different professionals. I can't comment on the particular individual and the connection with the private business, but what I would welcome is and be very happy to meet with both speakers who spoke earlier on. And you know, the 2 minutes isn't really enough to understand the nuances of that conversation. So very happy to invite both speakers, both around the York Travellers Trust and the ADHD Foundation work that we're doing. We chose that piece of work primarily because it really focused on a strengths-based conversation around celebrating diversity, celebrating neurodiversity, and what it brings for people, which, you know, as adults, there'll be many people, I suspect, around the table that may have neurodiversity to a degree, and we tend to celebrate it in terms of the workforce, but less so for children. And I think in terms of the work of the ADHD Foundation, it also addresses minoritized groups within already a minority group. So it doesn't just look at the very obvious points of neurodiversity. It extends much further into things like Tourette's syndrome and you know, young people that may well still have a great deal of issues in accessing services, but aren't often talked about. And developing a neurodiverse network, its fundamental principles are about co-production, bringing professionals together with parents and making sure that we can bring conversations together that haven't been brought together before in the city in that way. So it's all about co-production, which is why we felt that particular organisation was going to be a helpful piece of work. But as I say, more than happy to have that separate conversation and invite the speaker to come and talk to us.
Great, thank you, Martin. Councillor Webb.
Thank you, Chair. And yeah, just literally following on from what Martin's just said about the public speaker's comments, I was pretty much going to say the same thing. I'd really welcome that conversation with the public speakers about their thoughts and feelings, because we want to do this as a partnership and we don't want to not bring people with us. So yeah, really happy to be engaged and involved in that. Thank you, Maxine, for the report and for championing special educational needs and disabilities here tonight and in the city. I'm really glad that it's come here, because we need to be talking about this issue wherever we possibly can, because it is something that we all need to do our absolute best to do the most for in York. As well as that, Early Talk for York. Early Talk for York is so good that even though it was brought in the last administration, I'm even willing to talk about it. I mean, it is a really good project. I think that expanding it really does make sense, and you can see the benefits that it is bringing to young people. And actually, at Children's Scrutiny last night, where we were looking at the attainment gap between those who are disadvantaged by society and those who benefit from society. One thing that was noted was actually those young people in those schools that were really engaged with the Early Talk for York programme, there was a notable difference, and that's something that we need to expand, of course, if we can. Another couple of things that I think are really important, something that is often talked about from parents of young people with special educational needs and disabilities, is that how do I get information? Where is the information? Information's in 5 different places, that sort of thing. I was in a meeting, I've been in lots of meetings about SENS, both private and public, and something that came up was that exact point. And then it was really nice when another parent stood up and says, oh, well, the council's been working with us on this and we've developed a new website, and I believe that is yorksen.org. And that is it's so good when people say nice things. So I just wanted to highlight that, because I think that's a real positive step forward. I suppose my question would be around the local offer website then, about how often do we need to work to check accessibility? Because of course we've checked accessibility, but young people have this tendency to grow up. And so we need to keep looking again and again at that to just make sure that we are, that it is as up to date as it always can be, and whether people can be better informed. And the final thing I'll say on this is SEND neurodiversity is such a thorny issue at the moment in the city. And I think it is really important to say that in our schools, there is so much need for more support. And I think that comes in a number of different ways. And a lot of it is, some of it is beyond us in the city. So for example, I think, you know, Ofsted and the pressure that they put on the school system is something which, quite frankly, is very difficult to deal with, and causes the school system to narrow that curriculum. And by narrowing that curriculum, that can be very difficult for for everybody really. But if you're already disadvantaged by society, by other things, that is tough. It'd be wrong not to mention the fact that local authority funding is an issue. I mean, I'm glad, John, that you raised that drop in the ocean that Michael Gove has thrown at people today. But you know, and that's for adult social care, but local authority funding that then supports all those surround services around schools is just not there. And that has a negative impact. And then financial support for schools themselves. You know, we've got the worst funded authority in the country for schools. If you've got all those things coming together, it's a really, really challenging picture. But I'm very, very glad that despite of all that, we are moving in the right direction. It's not a quick process. It's not an easy process. And there are times when people will fall out about it, I'm sure, and people will feel left out. But, you know, I think that we are trying to work together to go in the right direction. And I think that things like Early Talk for York are a great example of everyone working for the best for the children. So, yeah, let's keep doing what we're doing and keep working hard. There's always things we can do to improve. But in a really, really difficult national climate, that is tough. I did have a question in the middle of that as well, you might have noticed, but there you go. Thanks very much.
Thank you. Right, I have got Sian, Councillor Runciman and Sarah to come in, and I'm really mindful of time. I said to my son before I left this evening, I said, if I chair it well, I'll be home by 7. And he said, see you at 9. And I said, it definitely won't be 9. So, but I'm desperately, let's just try and move. If people could be quick, that would be great, because we do have one more item to do and it's a really important one. So, Sian, if you could come down and be quick.
Sorry, I acknowledge being pithy and succinct isn't my forte, but I will do my best. I think, first of all, I'd just like to acknowledge I would love to change the language around this, but I acknowledge that's a national challenge rather than one for us. I know how many families would rather not have their children referred to as having special educational needs of any form. And I do want to kind of say, as an advocate of the social model, it's a little disappointing we're still having this conversation, but I do absolutely agree that special educational needs are not just a local authority or an education issue. And I think I've raised before with colleagues, what could we collectively do better when we first identify that there is a young person who potentially has a special educational need? Wincing again at the language. How do we better connect them with the things that are there to support them? How do we make sure that child has been properly identified as someone who may need support? I think it's really great that we're expanding Early Talk for York. And I think, as you say, if we could connect that with the SALT waiting lists to make sure that the people who are sitting waiting for 3-4 years to get that support, that's not a criticism of anyone working in speech and language, because I understand too many people need it, not enough people delivering it. But anything we can do to improve that is really important. I think it's also worth thinking about occupational therapy and what we can do, because that can make a fundamental difference to families as well. And everything we do at the earliest possible stage has the longest possible benefit for that whole family. So I think for me, I was just basically to say, I really want to recognise how much work has been done since the previous inspection, how far we've come, and let's keep going in that direction. So well done and keep going. Thank you.
Right, thank you for the positive comments. Councillor Runciman.
Thank you, Maxine. This is a question for you very directly, and I'll make it as quick as I can. I'm really pleased to hear the EHCPs are coming along more quickly now, because they were a thorn in my side at one point. But what I want to ask you is, does the provision of support for children have to wait for an EHCP, or are the schools putting it in before that happens, knowing that the child has a need?
Obviously, children will have already been identified at SEN support by the school. A number of schools start that, putting that provision in well in advance of the request for statutory assessment being finalised. They have to show the amount of support that they put in order to validate their request for statutory assessment.
As Councillor Webb has said, obviously our schools are very poorly funded. And so one of the things that would they like to be able to put in more support and more resource? I can absolutely guarantee that any school leader would say that yes, had they got the resources to devote, they would do that. But yes, the journey around putting the support in place begins as part of that journey towards statutory assessment. They don't wait until they've got an EHCP.
Thank you. Sarah, you wanted to come in?
Thank you, Chair. I'll face this way, it's just for the benefit of colleagues, but Maxine, I think I won't sort of labour the point, but just to sort of congratulate the work really. And I hear good things from my ICB colleagues. I should just say the SEND group and the work that's associated with it sits in our Nursing and Quality Directorate as an ICB, so it sits with our Chief Nurse, Teresa Fennick, and I know you've been working closely with Michelle Carrington, who is also the Director of Nursing within our York place, but also the ICB's lead for children and young people. So just to echo really everybody's comments that have already been made, and also to endorse that based on what I hear from the local system. I would like to pick up a conversation directly actually and meet you, Maxine. I find that very useful just to unpick and talk through some of the particular the elements that we've talked about in terms of commissioning and speech and language therapy, just to say it is the sort of one of the single biggest sort of challenges, I think, both in terms of our waiting times in the NHS, but also the capacity to benefit this population group. So it feels really, really key to get that right, and linking it, as we talked earlier about, to the waiting well. How can we better connect these services? We do that for adults. Why are we not doing it that for our children? So I'd like to take that offline with Maxine, if I may. Thank you, Chair.
Great. Yes, that's really welcome. And certainly the point that strikes me around speech and language is a year is a really long time to a 2-year-old, and 3 years is an eternity of time. And it's hard for us as adults to remember that, but it is a really, really long time for children to be waiting. And the younger a child is, the longer that is going to seem. So yeah, I welcome the offer to see what might be possible to be done outside of this meeting. I'm going to move on, if that's okay. Thank you for your report, which I think we just needed to welcome, didn't we? We just needed to receive the report. Sorry, I moved on before I'd actually read what I was supposed to do. We've noted yes, we have noted the contents and the implications, and we will move on. Peter, you are known for your brevity, so this is going to be great. Item 8. I'm going to start, because I know you're going to be so brief, I'm going to ask my question as I introduce you, which is, in the course of your remarks, could you include something around what is going on with our bus shelters and the work in this area? We might as well do that now. And then your remarks will be even more brief and more comprehensive. But thank you. The floor is yours.
Thanks very much, Chair. So we have a health and wellbeing strategy. We set ourselves 10 goals in the strategy, and what as a board we decided to do was take a number of those goals each time and cluster them into sort of themes. We have taken goal 1 in a meeting back in September, goal 2 and 3 and 4 in November, and today we're talking about goal 5 within the health and wellbeing strategy, which is about reversing the rise in the number of children and adults living with an unhealthy weight. The slightly sort of rounded up figures here are that in York, when we measure children's weight when they enter school, we're talking about 1 in 4 children living with an unhealthy weight. When they leave primary school, it goes up to 1 in 3, and when we measure it for adults, it's 2 in 3 adults living with an unhealthy weight in the city. So yeah, around about 63%, which is quite a large number. It drives all manner of health issues and conditions, and some of the goals that we've set ourselves and the actions that we're taking cross that boundary between supporting people to lose weight and maintain that loss of weight, but potentially and definitely actually the more important thing is to help the city create an environment which is not, and it's a fairly jargony word, obesogenic. So actually the city that people live in supports them to eat healthily, get physically active, and keep at a healthy weight. But the actions do start with the latter end, actually, around weight management. And it's an area I think that we could do better on as a city and nationally. Generally, weight management comes within a number of tiers. Our tier 1 support, which is essentially around that healthy eating, diet and nutrition and physical activity support, is provided by the City of York Council. There's some stats in there about a fairly successful service which aims to cover quite a large portion of the population. So we're supporting over the last year over 300 clients directly with sort of 6 sessions. But in terms of some of our sort of higher volume outreach through GP systems, probably into the tens of thousands of patients are hearing from health trainers every year with advice and guidance and that offer of support. Tier 1 for me works quite well. It's where you get into tier 2, 3 and 4. And an illustration of that is the fact that at tier 3, which is provided by York Hospital and commissioned by the ICB, we know that there's only really enough resource capacity for 100 people to receive support for weight management. And again, back to a theme of this evening, the waiting list there stretches to the 600 or 700 at any one time. And what it means is that people increasingly with higher BMIs are being seen within the health trainer service, which is probably not the most appropriate place for them. So I think action 9 represents some report on progress, but I think I'd say for the board more work to do actually in our weight management pathways within the city. Action 10 talks about the National Child Measurement Programme, which is run by the Healthy Child Service. We weigh and measure nearly every child in the city and have better coverage than national average, and increasingly thinking about the support offer which follows that weigh and measure, because in the end you don't do anything to help a child's weight when you just weigh and measure them. So that really, I guess, brings me on to actions 11 and 12. We have a lot of work that we've invested in over the last year around the very early nutrition for a child, which is either breast or formula milk, and how we can make sure we support mothers to be able to feed children well, to give them nutritious diet when they move on to weaning, generally between 6 and 12 months. And then as children get over, with healthy eating and physical activity interventions. One of the things that we do is the Next Steps for You and Your Baby workshop. And another is the Henry programme. Henry stands for Health, Exercise, and Nutrition in the Really Young, supporting families with the 0 to 5 age range around healthy eating when there's been an issue identified perhaps about the family environment and how we could support with nutrition. We're now looking at Henry and how it stretches into the 5 to 9 teens age, and how we get professionals referring into Henry and how we increase the numbers within that public health programme. And then finally, I will come on then to that wider determinants bit, that the environment we live in, the way the city supports people to have a healthy weight. I think it's fair to say that the weight that we carry is generally not down to individual choices. The food we eat is hugely socially determined. I think it would be a shame if we focus today really on the weight management. As important as it is, actually, what will make a difference here population-wise is the environment we live in. We know that more than 50% of our calories now come from ultra-processed food, high in sugar, very low in protein and nutrients. And we know that food is relentlessly marketed to us through companies that make billions of pounds. Coca-Cola has a bigger marketing budget than Public Health England's entire budget for the entirety of public health. So, there are some big players trying to get our society to eat unhealthy food. And that there's something about what we can do as a local authority, I think, and as partners, to just gently nudge towards healthier choices and make the options available for people to have healthy diets. One of the things that we have managed to achieve over the last few months is to work on the way that the council controls the spaces that it does control around advertising and marketing. And it's good to see that actually now we are going to be introducing policies which make the spaces on Chair, you mentioned bus shelters and some other advertising, free of adverts that are high in fat, salt and sugar for products high in fat, salt and sugar, uses a standard model, the nutrient profile model, to make sure that products are assessed against that. Just a little example, I guess, of the way that we can act as partners. I'm sure we could all think about things within our organisations. Vending machines often come up within healthcare facilities, the access to fruit and veg for some of our staff, I think is really important. Schools is going to be another setting. We do deliver the Healthy Start programme around vitamins and provision of fruit and veg. Children are entitled to an item of fruit and veg a day for a very limited amount of time within the education system, and it'd be great if we could expand that. So there are things we could do, but just ask for comments on this particular item for the health and wellbeing strategy, goal number 5. Thanks, Chair.
That was very good. Brilliant. Thank you, Peter, and thank you for answering my point in your remarks. Does anyone else have any comments or points they want to raise with Peter? I actually just wanted to, sorry, I'm going to take the liberty of adding another one to my list, was just around making space for girls. So obviously the other side to healthy eating and healthy weight is access to physical activity and space. And I know that as a local authority, there's lots of talk about provision of those things. Because the data isn't broken down boy, girl, which is probably a good thing, but actually we know that boys actually probably don't struggle as much as girls to access those spaces. We know that girls do struggle to access quite a lot of those spaces, and some areas of the city have done some work in trying to provide better spaces for girls. But I just wondered if there's anything else you could add on that more widely.
I can do. So we can break the child data down into male and female. And I think that is included in the indicator stuff, and it certainly is on the OHID fingertips profile. But absolutely, and I would sort of say to the board, we can take this point from the chair and bring that back when we get to the bit in the strategy and we cover the physical activity bits later on. And I think it's a really good point. The Make Space for Girls initiative, I guess I think it challenges us all to think about when it comes to that obesogenic environment, the gender differences and the way that unwittingly, and it's often raised about, you know, those sort of concrete spaces which become essentially very male physical activity spaces, and the simple things that can be done. And the project in Roundtree's Park, I think, is a great example of saying, actually, what can we do about making females feel safe in this environment? Actually, interestingly, bushes and foliage coverage and stuff like that actually makes girls feel less safe. So there may be some things we can do about sort of parks and public realm. So absolutely, I think there's a lot of work to almost observe and watch. How have we designed public spaces and maybe the systems that we all sort of play our part in that actually increase or decrease the amount of physical activity we are encouraging people to do? And does that have a gender aspect to it? Perhaps it might have a race or ethnicity aspect to it. I think there are all those factors within those types of provision.
Thank you. I think everyone wants to go home. I can't see anyone else indicating, in which case, thank you, Peter, for your report, which we note and have commented on. I thank you everyone for the contributions this evening. I think actually it was a really good illustration of why this board is so important, about bringing these partners together around some shared missions and goals for the residents of the city. Just on a personal level, it feels like a really living example of embedding health into the way in which we're operating as an administration. I've kind of felt like there were some real tangible steps forward in that regard this evening. So thank you so much for that. I understand the next meeting will be in May, probably. Oh, sorry, March. Thank you. And then the one after that will be in May. So thank you for that. And I hope everyone gets home. So look, I'm going to get home for 7. So I'm going to pass the test. Thank you, everyone.